Right. Osteoarthritis is the most common type of arthritis and a very common disease of elderly. It is one of the leading cause of disabilities in India. Good evening and a warm welcome to IHW Talk Show on osteoarthritis, early signs, symptoms, causes and treatment in partnership with Manipal Hospitals. I'm Ridhi Lakra, Assistant Editor, IHW.TV. IHW Council is a non-for-profit organization engaged in health and well-being of human enterprise and existence. According to a study, India might become one of the countries with and it might become a capital of osteoarthritis in entire world with almost 60 million people by the end of 2025. And in the last few decades, Indians in the age group of 30 to 50 years are falling prey to osteoarthritis and continues to have a serious impact on the lives of elderly people. India is likely to notice an endemic of osteoarthritis with almost 80% of the people in above the age group of 65 years, and the country will be suffering with the wear and the tear of joints. While the disease is a burden, and the increasing burden of the entire disease is very important. It's very important we discuss about it and create an awareness about it. To talk about this, we have with us today Dr. Sunil G Kini. Dr. Kini is a consultant orthopedic surgery at the Manipal Hospital, Bengaluru. I welcome you, doctor. We also have with us Mr. Umashankar. He is the lead officer, Physical Medicine and Rehabilitation, Manipal Hospital, Bengaluru. I welcome both of you for the session.
Thanks, Riddhi.
First, I would like to start with Dr. Sunil to understand what exactly is osteoarthritis and what are the various symptoms that people can see, signs and symptoms that they can see.
Yeah, thanks. And thanks for having me on the show. And first of all, we all realize, as you aptly said, that arthritis has become an increasing burden on our society, and a lot of them are modifiable risk factors. So when you say osteoarthritis, osteo means bone, arthro means joint, and itis means inflammation. So joint is a place where the ends of the bone meet and where you have movement. So any inflammation of the joint is called as arthritis. Now, when we say osteoarthritis, is actually wear and tear because of increasing age. So this is what we call as age-related arthritis. But there are other kinds of arthritis which we'll talk along, which are important as well, because it's a myth that arthritis involves only the elderly people. So there are a lot of arthritis which can involve the younger population as well, which we'll probably subsequently talk about. Coming to the next part of the question, what are the symptoms and signs of arthritis? Yes. So when someone comes to arthritis, the following points that they come up with. First thing is pain. Pain is the foremost sign of arthritis. When you say pain, the pain is initially only described on, say, deep bending activities. So if you're talking of the knee, they complain of pain only on deep knee bending, or squatting or sitting cross-legged, which is very common among the Asian population. But as the severity of arthritis and the stage worsens, then they complain of pain even on lesser activities like just climbing stairs, sitting to standing, and their walking distance goes on decreasing. So they can no longer walk for, say, 100, 200 meters. That time you know that the arthritis has actually become advanced. So pain is the number one symptom. Second symptom is swelling around the joint, because arthritis can cause a reactive swelling. There's a lot of fluid in the joint, and this can give rise to swelling. Swelling also occurs when in advanced arthritis, bone starts rubbing each other, and then there's what we call as reactive effusion. So swelling is the second symptom. The third symptom can be difficulty knee bending. So patients can have restriction of knee bending because they have pain and the bones start rubbing each other. So that's the third symptom they can come with. Other symptoms can be crepitus. So in advanced arthritis, as the bone rubs bone, then you hear a sound. Patient can hear a sound as they bend the knee, what we call as a crunching sound. That's the fourth sign. And sometimes fifth sign, they can have what we call as inflammation or redness around a joint. So these are the common 5 symptoms that they present with. So pain, redness, stiffness, restricted movement, and swelling.
Dr. Sunil, just to add on to this, are there different types of osteoarthritis to be categorized? Is there a category of that?
Yeah, precisely true. That's what I was coming to. So when we say age-related arthritis, which you usually see after 50, 60, that's because of wear and tear. And that's called osteoarthritis, to be precise. The other kind of arthritis, which you commonly see, especially in the younger population, is something called as inflammatory arthritis. So these arthritis can involve patients as young as the second decade. So 18, 20, 25, 30 years, you see people coming with pain. And these categories are inflammatory arthritis. This is inflammation is basically because it's an autoimmune condition. So here what happens is patient's own defense mechanism, acts and destroys the patient's own cells. So it doesn't recognize which is foreign and which is our cells. So it reacts to the lining of the joints, which we call a synovium, and then they cause inflammation, swelling, and then they eat away the joint. So this is inflammatory arthritis. Commonest among them, you might have heard, is called as rheumatoid arthritis. So rheumatoid arthritis involves a lot of younger population, and these are usually detected with special blood tests. And they usually come with symptoms of, say, small joint pain like fingers and wrist. Whereas osteoarthritis involves mainly the hip and knee, which are actually the weight-bearing joints. So this is a second category, inflammatory arthritis. There are other conditions like, apart from rheumatoid arthritis, like what we call as psoriasis, which mainly involves the skin lesions. Then there's something called as ankylosing spondylitis, which mainly involves stiffness of the knee, spine, and the hips. So this is a second category called inflammatory. Third category is a category called as connective tissue disorders, where the connective tissue is involved, like lupus and Jordan syndrome. See, these are the third category. Fourth category is injury. Supposedly, if you have a fracture around a joint, say a knee fracture, after 3 or 4 years, if it's not treated well, or if you have a joint involvement at the time, they can come with arthritis. It's called as post-traumatic arthritis. So that is another category. There's some conditions called as metabolic arthritis, like gout. I'm sure you would have heard of gout, where this uric acid in the blood increases. So if you leave that to occur, then uric acid goes into the joints and causes crystal deposition and causes gouty arthritis. That's fifth. And lastly, another category called as infective arthritis. Suppose you have an infection, say septic infection, or even say post-COVID, like post-viral infection, they can have joint pains. That's arthralgia. So long-term, if it infects a joint, then it can call what's called septic arthritis. So these are a few types of arthritis, but I think osteoarthritis basically refers to age-related or wear and tear arthritis.
Thank you, Dr. Sunil, so much. And just to add on to your question, another one I wanted to clear that. Is osteoarthritis is it more common in men or women? How is it like?
Well, generally speaking, to the consensus, it's probably more common in women compared to men, maybe due to various reasons unknown. We also have to see that a lot of, one of the prime conditions for arthritis could also be genetic. So there's no clear consensus, but females are slightly more affected than males, probably because of the nature of work they do, especially in the lower limbs, like knee, especially the knee arthritis that is most commonly prevalent in India.
Thank you so much, Dr. Sunil. I want to move to Mr. Umashankar and talk about what are the various risk factors about osteoarthritis, and in what cases can we get this?
Yeah, thank you, Riddhi, for your kind this thing, and I thank IHW for this wonderful scenario here. So let's get back to the answer here. So here the risk factor, as Dr. Kini was also mentioning about, it's like older age. As our age progresses, is one of the most commonest, one of the disease which comes on. And other one is like sex, like a male or a female. Just Dr. Kini was giving you the right answer. Especially like female are more prone for this osteoarthritis comparing to the males in a ratio of 2:1. Probably one of the reason it could be the menopause. So probably one of the reason, but not that is the 100% this thing, and probably the nature of the work, as Dr. Kini was explaining. And the other factor would be like the obesity. It is one of the major cause where it leads to osteoarthritis. And as another factor comes on, like genetics, as one of the genetic, what we usually call it as ED syndrome, Ehlers-Danlos syndrome. So which mainly affects this connective tissue, especially the joints here. So that is one of the cause here. And bone deformities. So any of the bone deformities, even let it be more congenital from the birth, from the birth, is there any bone deformities? So where like the structural deviation or the distortion of the bone's shape from the normal alignment. So if there is any deviation or the distortion of the bone shape from the normal alignment, that also like in future, slowly it leads to osteoarthritis. That is one of the other causes. And the final would be like the metabolic diseases. Any metabolic disease which is related to obesity, again, is one of the other factor which causes this osteoarthritis.
Thank you, Mr. Uma. Like I wanted to ask another part of it. Like, so osteoarthritis it's like always a genetic disorder. Is it a genetic disorder or it's a lifestyle disorder? Like gradually you can get it. What is it like?
Yeah. So this question is still on a debate actually. So like we can say around 40 to 70% of the thing which comes on due to the heredity. And we can keep around some 30% due to the lifestyle. Nowadays, like more of sedentary lifestyle, including the men and women in their job. So where the sitting time is a bit longer time. I mean, like previously, like the exercises part are a bit less. Some of them where the weight where they will input on more weight on that, which again leads to obesity. So that causes the damage here. So which we can keep around 30% of their lifestyle.
Thank you so much, Mr. Uma. Dr. Kini, I want to come to you and we can as we discussed about the various signs and symptoms about the disease. So once the disease has been diagnosed, is it always compulsory that there should be a surgery in this case or there are other options as well to reverse the entire process of osteoarthritis, or it is not reversible? If somebody gets osteoarthritis, it's there for lifelong or they can only control it with the medicines. What is it like?
Yeah, that's a good question, Riddhi. So the treatment basically depends on what stage the patient has come to you with. So basically, there are a lot of patients who come with early stage arthritis. A lot of people come in mid stage and late stage arthritis. So there's various ways to classify that. One is depending on the symptoms and also some the basic thing what we do is X-rays. So when they come to you with the early arthritis, then this treatment is varied, and it's usually, luckily, 80 to 90% treatment of them is usually, lifestyle modifications and physical therapy, which is a very integral part, and to have an active lifestyle, reduce your body weight, and so on and so forth. Some diet modifications also will help. Surgery is only a last resort. So surgery you do only in advanced arthritis where patient can't walk a few steps. It's basically to change your lifestyle so that you can be more active and not suffer in pain. This is stage 4. So when we categorize arthritis, it's 4 stages on an X-ray. The first stage wherein the fluid dries up, the second and third where the bones come close, and the fourth stage is the stage wherein the bones touch each other and grind each other. It's a very bad stage, an advanced case wherein nothing else will help. So, but largely people come to us very early. So in those stages, treatment are as follows. One thing is we ask them to follow a good diet, especially some diets, especially known to be rich in omega-3 fatty acids, like olive oil, fish, whole grains. All this will help. Reduce your body weight is very primarily. Research has shown time and again that people who have an increased BMI or body mass index are likely to suffer more arthritis, especially in the hip and knee and ankle, which is the weight-bearing joint. So we ask them to definitely reduce their weight, which will help. Physical therapy, as Uma will highlight, is also very important. At least 30 minutes of exercise 5 days a week is important. And what we call is a low carb exercise, especially like cycling, swimming, and walking. As simple as walking is going to help. Apart from that, medicines is also prescribed. If there is too much pain, a short-term course of analgesics or anti-inflammatories will help reduce the inflammation. We can also do therapies like ice and heat to reduce the inflammation, and also support them for physiotherapy. So physiotherapy is a very integral part of arthritis, wherein they teach you strengthening exercises of the particular joint so that there's not much load on the joint per se. So when you strengthen your muscles around the joint will not take out much load. Where in some cases, we also give medicines like, viscosupplementation, which is artificial, either oral tablets or injections, which is actually the injection in the knee, which dries up. So you can artificially inject those or give them as capsules. They're not definitely prone, but definitely that can help, arthritis. So these are the various categories of treatment, but none of them will actually reverse the disease. That's the question you asked me. So you can only halt the progression of the disease. You can't reverse them, but you can significantly add more life to it. by these measures.
Thank you so much, Dr. Kini. Dr. Kini, just to ask another part of it, when you say medicines, so are these medicines in a form of a steroids also that can affect people, or is it a normal medication?
Yeah, steroids are basically never prescribed for osteoarthritis. As I said, it's because of wear and tear. So the main medicines what you prescribe, I told, is a short course of anti-inflammatories for the pain or analgesics, and visco. I told you oral medicines to replace the fluid, which is called visco supplements. That can be prescribed. Apart from that, steroids is usually not prescribed, especially for osteoarthritis. But if it's a part of inflammatory arthritis, like say rheumatoid arthritis, then it can be prescribed by a separate category of doctors called rheumatologists, who are physicians. They deal with this inflammatory arthritis. So they can prescribe, especially as a short course, to reduce the inflammation. As orthopedicians, we don't like giving steroids because, as you know, steroids can also cause what we call as bone death or avascular necrosis. So this is a special condition I would like to mention through your channel, where especially post-COVID, a lot of COVIDs may patient have lung infection. So steroids is actually life-saving. So you don't think much when you have to save life. But having taken high dose of steroids over a constant period of time, they can develop a complication called avascular necrosis. So this is a condition where the blood supply to the bone is eaten off, and then the bone starts collapsing. It's called bone death. So if that is the case, then usually they may require surgery. So steroids is something which we usually avoid, especially high dose and long duration. But if it's life-saving, as I said, conditions you may have to give, but patients have to be aware that this can be a side effect of steroids.
Thank you so much, Dr. Kini. Just to continue with Mr. Umar, as Dr. Kini was talking about the various, the role of physiotherapy in this. So how does exercise and hot and cold therapies, all these can help bringing back our joints, like
Yes, Rati. So here, every time we can't generally depend on the hot and cold therapies. Maximum number of the patients, they usually get benefit from the hot therapy. But sometimes even when the joint get bit swelled up, either we can just say any inflammation. So any inflammation will have a bit of few signs where the joint will be little warmth, like when you touch, and you will be having a bit of redness around your joint there. And where it will be like a bit of pain, which is restricting your range of motion, which is like normal bending and straightening it. So in these situations, like in inflammatory situations, we better always go for the cold therapy that will just try to reduce your inflammation there. So on top of that, these hot and cold therapy will help in these things. And other way is especially being a physical therapist, when we just look into a joint, so always the prior one will be the joint examination. So how the joint is, so how the attitude of the limb is. So in few of the patients, the joint may be in the bending condition where the joint straightening is not completely there. So in few of the patients where they couldn't able to raise your leg straight up, where your muscle weakness is there. So it depends clearly on the joint examination. That is the first one. The second one is the attitude of the limb, how the limb is there. When you see directly, either the limb is completely straightened or either the limb is little bent. So whatever it is, first we have to correct the attitude of the limb, and then comes to the joint exam, help the patient, or either the strengthening program will help. So commonest cases in osteoarthritis, especially the hamstring, the muscle, the one which is there in the posterior thigh. So that will go for a bit of tightness. And along with that, the lateral structures, the outside part of your thigh, that goes for more of tightness there. And the weakened part will be more in the inner thigh area. So those particular muscles will go for weaker. So as a physiotherapist, a prior examination, which we will be doing it on, and we will be just checking either the stretching will be helping the patient or either the strengthening or both. So that's the way which we will be looking for it.
Thank you, Mr. Uma. Dr. Kini, coming back to you. When we talk about to understand for a basic understanding for the people, what exactly is the role of a cartilage and how it's been affected in osteoarthritis?
Yeah, so cartilage is a firm rubbery tissue which covers the end of the bone. We said a joint is a place wherein the movement occurs. Joint is a place wherein the two cartilage from the two ends of the bone meet. So this cartilage is very important because it's like a shock absorber. So when you do, and there's a fluid in between called the synovial fluid. The synovial fluid and both ends of the bone, which is actually covered by cartilage, are facing each other. So when we say, arthritis basically involves that a part of the cartilage starts wearing off. Right. So if there are some parts of the joint which is actually bears more weight. Commonly say if you have knee arthritis, the inner part of the knee takes more weight than the outer part of the knee. So the wear also is seen mostly in the inner side of the knee. When you do an X-ray, you see the outer side is usually okay and pristine. The inner side is where the bone come close to each other. So this is what you meant by arthritis. So what happens? The cartilage starts wearing off. So usually it's a small area of cartilage which wears off. Which is called as a chondral defect. But if you allow it on a longer time, the whole part of the knee, which is called by cartilage, slowly wears off. And then you have the bare bone, which is exposed. So once the cartilage is gone, then the bare bone is exposed. That is when the arthritis starts progressing rapidly. And then they come closer to each other to a state extent wherein they touch bone, and then it's called as advanced arthritis. So cartilage basically is a covering part of the end of the bone, which helps in kind of reducing the stress on the knee. It acts as a shock absorber, and also helps to lubricate the joint. So the role of cartilage is primarily very important, because that is the beginning of arthritis.
Thank you so much, Dr. Kini. Mr. Uma, there's another part of the, we spoke about age is one of the factor for as we grow old, the disease, the chances of the disease increases in the older people. So are there other cases as well, like we were discussing of the lifestyle issues, people who are overweight, who have obesity, in cases of the female, the menopause is also one of the reasons. Apart from these, are there any other reasons also that like there were studies saying that India will almost in 2025 people will see more of cases of osteoarthritis in India. So how far is that true, and what can actually people do?
So in this cases, it's like as even Dr. Kini was explaining before, so more of inflammatory arthritis. So any arthritis which comes more of genetic, for example, autoimmune diseases, what Dr. Kini was telling about, which is, for example, rheumatoid arthritis, where it's basically a genetic predisposition of HLA-DR4. So where these peoples will definitely get more of quicker joint disruption there. So no matter age there, even if it is 20, 25 years old, so especially they will end up in these kind of damage of the joints. It starts from basically the smaller joints, then gradually it spreads up to the weight-bearing joints, especially the hip or the knee, and even sometimes even the ankle too. And in these cases, in the extreme cases where the joint will go for deformed, so we call it as completely deformed joint, where it can't be bring it back to the normal position. So in those cases, like in the beginning, as soon as when you're diagnosed with these kind of this thing, we the physiotherapist will start doing more of gentle stretching exercises and strengthening exercises, wherein the joint should not get into the contracture. So once the joint gets into the contracture, it is quite irreversible to get it back to the scenario there. So for example, when you come to the knee joint, we usually call it as the fixed flexion deformity, FFD. So in those cases, we can't bring the knee to the complete 0-degree extension, where the knee will be fixed in some 10 to 20 degrees of bending. So where it is fixed, this thing, deformation. So get instead of delaying it, as soon as when they come to know about, where they have this particular disease which has been diagnosed. So starting early physiotherapy definitely will help in those cases. And apart from the other one is previous joint trauma. So any previous joint trauma, let it be even some 10, 15 years, and it has been the healing stages. In those cases in the future, slowly, where the joints get into the damage, where it may end up in osteoarthritis. Even if there is any small tissue, what we usually call it as meniscus, which is there in between the knee, for example. So when it gets involved, so automatic, that is usually acts as a kind of friction, where it avoids the friction between the two bones. So in those cases, meniscal plays a huge role. So in few, in young stages where people have this meniscus injury, those people are later stages who are more prone for this osteoarthritis or the knee pain, and even the ligament injuries as well, or the fracture as well. These are the things where the other few factors. And one more other stuff is what Dr. Kini was telling about is the avascular necrosis. So in those cases where the blood supply to the joint is completely cut short, even that can be happened due to the trauma, any injuries, where your blood vessel all get ruptured, where there is no blood supply to that particular joint. So in those cases, definitely, yes, the patients may go end up in avascular necrosis. In those cases, definitely the joint will involve in this scenario, apart from the normal osteoarthritis.
Thank you, Mr. Uma. Dr. Kinney, I want to ask in the similar lines, like what Ms. Uma was telling about the trauma injury. So, is it like a very common thing in athletes as well, or is it like a different kind of arthritis what they would experience in future? Like a lot of athletes practice a lot, they run, they do weightlifting, all these. So, is it osteoarthritis can happen to them as well, or is it like a different thing to them, like category for them?
No, the category remains the same. Obviously, the intensity with which workout is important. So athletes also is very important. We say that they have to do the right stretches. So stretches is basically to maintain the the stretchability of the joint. Otherwise, they're more liable for injuries. So people who take up any sport nowadays, we see that a lot of people in the urban cities are are quick to grab up any sport. But it's also important that you take precautions to make sure you do a proper warm up before you actually play the sport. It may be different for different games, and so that your joints are quite lubricated and your muscles are conditioned. Similarly, once you play the sport, you do what is called as a cool down. So warming up, cooling down, and keeping your joints supple is all very important when you do play a sport. Otherwise, you're liable for injuries. So we get a lot of people not only with arthritis but with ligament tears and bone and bruising. Athletes who run actually without warming up, they can have something called stress fractures in the legs because of running marathons. Marathon running has become a big in thing nowadays. But if you're not trained to do a marathon, you don't do those escalate it gradually and suddenly try to run, you may have these shin splints or stress fractures. So ultimately, when it comes to arthritis, the same type of arthritis for athletes, non-athletes, but just that their presentation may be different. They may have all these additional issues which we have to deal with. Otherwise, there's not much of a difference.
Thank you so much, Dr. Kinney. Dr. Kinney, just another sort of a question to ask about, like, people are we are all aging, and at what age actually we should actually start taking care of our bones, joints, and what exactly we should do? If it is if it's kind of little genetic, that it is there in your family, you might also get in the future. And the way we are living a lifestyle, we have become a lot of sedentary, like we are very lazy doing things. But as you said, some do exercise, but there is also another set of people who are very lazy. So at what age we should actually start taking care of ourselves, and as we age, that we don't get osteoarthritis or any form of arthritis?
Yes, surprisingly, if you see, our ancestors used to be very active, used to do a lot of field work. Nobody used to have a sedentary job. And so they used to live long, and they used to have a long, healthy joint as well. But nowadays, with urbanization and, the culture of doing a desk job, especially post-COVID and during COVID, work from home has actually made it worse, because we see arthritis coming or setting in at a quite early age. So there's no age which is exempt for arthritis. As early as the third or fourth decade itself, it can start coming, especially with genetic factors. If you're not active, then you're at a big risk for developing arthritis. Inflammatory arthritis, all this we know that is because of genetic factors, but osteoarthritis is mainly something which you can control. So what you can do is, anyone, say someone as young in the 30s, so there's no age to start exercising. So early exercise, as I said, regular exercise, at least 5 sessions, 30 minutes a day, aerobic, anaerobic exercises will help. People who have arthritis should be careful. I say they should do low volume, exercise like cycling, swimming, and walking, which is good enough. Lower your body weight is very important. So obese people have an increased incidence and progression of arthritis, especially the knee joints. So reducing your body weight is very important. Keep your BMI in check, and your food intake is also very important, especially for the ones of the inflammatory type. Try to avoid eating processed food, refined sugar, complex carbohydrates, eat more of omega-3. All this is probably keeping your joints more supple. Doing stretches is important, because as you age, your joints become more stiff. So it's important to have supple joints. So doing yoga, tai chi, all these actually improves your flexibility. Apart from, so these are something which is called as preventive measures. And this is largely important. And the earlier you start, whether you have risk factors or not, the more likely you're going to benefit out of this.
Thank you, Dr. Kini, so much. Coming to Mr. Uma, as we discussed, osteoarthritis, we cannot reverse it back. So, what are the success rate of other ways, alternative medicines in this? There is acupuncture, acupressure, meditation, yoga. Can all these also help in maintaining a normal life with osteoarthritis?
Yeah. So here, I mean, being in a physiotherapist, yes, we have been seeing almost a number of osteoarthritis cases in a day. So if you ask me, yes, of course, there are huge success rate. It depends on the grade of the OA, where Dr. Kini was explaining about the grades of OA, where the fourth grade, where completely the joint comes closer, there is absolute zero joint space, and where there is a thickening of the joints. I mean, where almost there is a zero mobility, where the knee can't bend fully or the knee can't extend straight. So in those cases, I mean, it's quite a bit difficult. But in earlier stages, the more we diagnose more earlier, so it is possible to reverse it back or kind of get back the normal strength of the person. Two things which is again more important, which we'll concentrate here, is the strengthening of the quadriceps muscle, which is the front thigh part of the muscle, which has to be more strengthened. At the same time, the hip musculature, which is one more other common thing which we will be looking for. So it doesn't mean always we have to just see the affected knee. So as being a physiotherapist, we usually see the one joint above and one joint below. So for example, if the knee is affected, we have to see as the limb as the whole. For basically you have to concentrate more on the hip, knee, ankle as well. So in those cases, of course, if it is a grade 1 or grade 2, sometimes even a grade 3 case is also possible to get back the normal strength and the mobility by doing the strengthening program of the quadriceps, main the thigh muscles and the hip musculature. And of course, as we get older, there will be a little compromise in the balance issues, especially in elderly people. So here in Manipal, we do provide a lot of advanced balancing exercises as well as the proprioception, which is normally called as joint sense. Yes.
Thank you, Mr. Uma, for that. And I hope a lot of people who are listening will understand what exactly is osteoarthritis, and a lot of these exercises how they can help them. Dr. Kini, coming back to you, just to understand, is it osteoarthritis is seen in children as well, or in the middle-aged people also, or is it only in the age of 60 only? After 60 or maybe growing old it starts. Is it that true?
As I said, osteoarthritis specifically, refers to wear and tear arthritis. Earlier, we used to see largely people post 50s and 60s used to get arthritis because of wear and tear. But nowadays, because of the sedentary lifestyle, because of our eating habits, because of our lack of exercise, so have seen people even in their 30s coming with arthritis. So it shifted probably a decade or so earlier. So any age is not exempt from osteoarthritis, especially post 30s and onwards. So you have to be careful that way.
Dr. Kini, again coming to you about this, you already spoke about some of the preventive measures of what can be taken into account to reduce the disorder. So if you can brief some of the points again, and we would almost come to the closing of the session as we discuss this.
Yeah, first thing is to as I said, you have to reduce your body mass index. So these are what we call as preventive methods. So reducing your body mass index is very important. So if you're obese, you are at increased risk for arthritis, definitely. So try to reduce your body mass index and body weight. This you can do by eating healthy, eating a good balanced diet, reducing your eating of processed food, and refined sugars and all those things. And also eating more of fresh fruits and vegetables, diet rich in omega-3 acids like olive oil or fish. All these will help. So that is related to diet. The second one, exercise. I said, you have to exercise regularly. Any type of exercise is good, 30 minutes at least, 5 times a day. For people who have arthritis, low impact exercise like cycling, walking, or swimming is going to help. Pick up any sport. Many people find going to the gym may be tedious. So, but definitely there are sports which they may have liked before. So this is a good time to pick up any sport, because that itself is a form of good exercise. So that is one thing. Next would be to make sure that you do also the stretches which are helpful for your joints, so that you keep your joints more supple and you're not liable for injuries, especially when you start playing sports. Quit smoking. Smoking is very important risk factor for the arthritis terms of connective tissue stretches and all. So try to do that. And do a good routine program. Avoid injuries as far as possible. When I say avoid injuries, make sure that you do your warm-ups, cool down, and all those stretches before you actually, do a marathon or run for an event or pick up a sport for that matter. So all these are preventive methods by which you can make sure that you can have a healthy joint, which is going to last for a long time.
Dr. Kini, just to contradict one of your points, like you said, mentioned about the doing exercises, physical activity. But in case of if somebody already has a osteoarthritis, is it advisable that they do start doing physical activity, and can the symptoms get worse in their cases?
Yeah, that's a good question. That's why I said low impact activities. People who already have arthritis, we never stop them from doing simple things like walking or doing a stationary cycle. So if you have advanced arthritis where you cannot do, then obviously that is not an indication. But many of them who are in mild to moderate cases, say grade 1, 2, 3, they definitely, benefit from all these exercises. So firstly, if anyone comes to with arthritis, first thing, obviously, if it is bad, we ask them to do physical therapy, wherein, they do this, strengthening exercises. And post that, we ask them to have a good and healthy lifestyle. Walking is never too painful. So if you're very painful that you can't walk, then X-ray shows advanced arthritis, then medicines and this won't help. Then obviously it needs a surgical treatment. But otherwise, simple, exercises like just doing a morning walk would help a lot. We ask people with arthritis not to run, jog, and not really high impact, but these kind of low impact activities can readily be done. And especially things like swimming, or what we call as hydrotherapy, is actually a very good therapy for arthritis.
Thank you so much, Dr. Kini. Mr. Uma, I want to come back to you and ask about what would be the preventive measures that we can take, and in terms of the disorder, the entire osteoarthritis, and also adding a physiotherapy part to it, and how can physiotherapy actually help?
Yeah, so here, people already with osteoarthritis, as you were questioning Dr. Kini, so people who have already arthritis, we can't tell them to do the advanced exercises, all those stuff. So here in physiotherapy, what we usually do is we do have a main 3 components in this. The first component would be always the pain management. So definitely once we try to reduce the pain, the patient automatically they will be doing more of exercises. So with the pain, we can't advise the patient to do exercises. So we do have a lot of options for this pain management, in physiotherapy, medicine. So where for example, we use a lot of you've been asking about acupuncture and other type of yoga steps. Yeah, so we do have a lot of other options, something what we call it as dry needling to release where the tightened muscles, where it will try to improve the flexibility. And sometimes even we do taping, which is one more other stuff, what we call it as. It reduces the joint swelling, where once the joint swelling comes down, where the mobility of the joint will improve. That is the second point. And the third point is joint mobilization. So directly where, for example, in a knee, we do have 2 bones, one is the femur and the other one is the tibia. So we completely get into the joint and we try to mobilize the joint in where towards the restricted pathways. For example, if the bending is more restricted, we'll try to more of to get the bending one by doing the joint mobilization. For example, if it is extension, we will work on more on extension to get that complete movement. So that's why I told in the initial before getting into the treatment, the attitude of the limb is very, very important to get into it. So this is the first role, pain management. So once we make the patient completely pain-free, maybe around 3 to 4 sessions, then we can get into advanced strengthening systems. So even though in the strengthening system, we directly don't jump into heavy exercises, high intensity exercises, for example, squatting, all those stuff. But that will again get the pain back, and they will be again going back to the same stage. So in this way, we usually advise offloading exercises. Basically, offloading in the sense patient can do more exercises either in sitting or either in lying down position where the joint is not in the load. So in those ways, we will try to build up more of your quadriceps strength, the thigh muscle strength, and the hip musculature strength as well. That is the other point. So once the muscle has got enough amount of strength, then we will be trying to put on the loading exercises, where initially we'll start with offloading, then we'll come back onto the loading exercises. It depends upon the stage of improvement. And the final one, as I told, was like obviously the balance and the proprioception along with the strengthening exercises will make the patient more beneficial in the term of confidence. So that is one more other main important role. So these are the three criteria which we have to look for it. But apart from these three criteria, there's one more other thing is like lifestyle modifications. Along with this, lifestyle modification is very, very important here. So basically we do joint protection techniques. So what are those joint protection techniques? So for example, in case when you take in the knees.
Yeah. So they're doing a webinar for everybody else. That's a doctor. She's a physiotherapist, so there are people who are joining to ask questions.
Okay.
Mr. Uma, you can continue. Mr. Uma, you can continue. I think there was somebody in between the call.
Yeah. So last thing what I was talking about was the lifestyle modification. So the first, yeah, I can hear you. That's okay, no problem, no worries. So in techniques. So how does the joint protection techniques help? So basically, when you come into the knee, there are the two most common deformities where it is. So we do have a lot of orthotics, external devices where we can fix to the knee to correct the deformity activities. So what we call it as the joint protection techniques. Other one is footwear modifications. That is one of the vital role which we usually think about it. As we get older, sometimes, I mean, few of the patients, as I've noticed, when they stand, I mean, like you would have
Mr. Uma, can you hear us? I think we lost Mr. Uma. Dr. Kini, I want to come back to you and ask like a very important question. So if somebody sees the symptoms in themselves that they have joint pains, they feel this. So whom should they consult first? Should they go to an orthopedic, or should they directly go to a physiotherapy or start doing exercises, or what should be the procedure?
So if someone presents with joint pain, say for an increased duration, so more than a couple of weeks, and with no history of injury, that's what we mean. So if you have not had an injury and you have progressive joint pain more than 2 to 3 weeks, then probably you should seek help either with your general physician or directly with an orthopedic surgeon. So depending on the symptoms, they may examine you and probably will ask for an investigation, especially if they suspect that there's an arthritis which is setting in. A basic thing what you can do is an X-ray. So we do standing X-rays, especially in the elderly, to make sure that we see what the status of the joint is. You can actually see a lot of things with an X-ray, and probably it's the only thing that you need to evaluate someone with arthritis. So you can grade from 1 to 4 depending on what the arthritis show. But it's very important to have a standing X-ray and not a lying down X-ray, because that's where the load actually is shown. So there can be a contrast of difference between a lying down and the standing X-ray. So standing or weight bearing X-rays is what we look at. Sometimes there's a lot of pain which is coming from the kneecap, which is in front, which is a round structure called in the front of the knee and not the knee joint. So views of skyline view, which also help to see the kneecap separately. So the doctor also will examine you to see where exactly the pain is. Is it in the ligament? Is it in the muscle? Is it in the joint? Or which kind of contact it is? And so physical examination, history taking, physical examination, a basic X-ray that is usually done for arthritis of a longer duration. And then if the doctor suspects anything else, like inflammatory arthritis, then blood tests will be the next step. And this is usually enough. Lastly, as I said, many of them is if it's an early and arthritis, then they will ask you to do take some short-term medications to reduce the pain, and avoid certain activities like squatting, sitting cross-legged, reduce your stairs. And once the pain comes down, then you will have to probably be advised to do a course of physical therapy to strengthen the muscles around the knee and to improve the flexibility of the knee. So if anyone has joint pain, say more than 2 to 3 weeks duration, progressive of any age, then probably you should seek help.
Thank you so much, Dr. Kini. Dr. Kini, just to add another thing, like a lot of people are not aware of osteoarthritis and they are more aware of general arthritis. So like if somebody, as you said, if somebody is having joint pains and all, should they like consider that they also have an arthritis in a generic way, and like on themselves they can go to a doctor and ask, or is it like a procedure? As you said, there are procedures like you do a blood test and all, but then there are set of people who also have a like a thing that my parents have it, so I might also get it, and they also start medication on their own. So is that a right thing to do, or is it also always advisable that you go to your doctor, consult with them, and then you go up with the medication or whatever the physiotherapy doctor suggests?
Yeah, a lot of people otherwise would anyways come back with us after having taken a course of medicines anyways. So anyone with on and off pains or muscle or joint pains would take a course of medicines for 2 to 3 days, and then subsequently would have noted that it would not have improved, and then probably would consult us. So it's not that if you have joint pain, you immediately go and see the doctor the next day. But obviously, if you have pain which is progressive for more than a couple of weeks or 3 weeks, then probably you should seek help. Nowadays, simple things, a lot of people have what we call as vitamin D deficiency. You know that, right? So people who are indoors, not exposed to sunlight, not, having food which is rich in vitamin D can cause vitamin D deficiency. And this is probably one of the commonest cause of joint pains. And they come to us and we see probably you will just give a course of vitamin D, do a blood test, and you see surprisingly their levels are at least 1/5 or 1/6 of normal. And so just giving a simple course of vitamin D, either as a tablet or injection or like a sachet dissolved in water or a syrup, can actually for 3 or 4 weeks continuously can actually get rid of the pain. So not all pains are arthritis. The simple deficiencies can cause pain like that. So obviously you have to consult your doctor and then take treatment for all these conditions.
Thank you so much, Dr. Kini. I hope after listening to you, people do come to you and they go to their experts and talk about their pain as well, and not take their own medications as well. Mr. Uma, we just had a break because of the network issue. I want to come back to your answer that you were answering and adding to another part of it. A lot of people do, like on a regular basis, people do not do any stretches and all. But do you think it is recommended as we grow old? Is it compulsory that we do a regular stretching and flexing ourselves so that it can help in the future and we could feel better? I mean, we should not have any sort of arthritis. Is that a solution like on a longer run? You're on a mute.
Can you hear me?
Yes, now I can hear you.
Yeah, of course, right. Yeah. So the main important role is here is as we grow older, the tendency of the muscles like more into getting into contracture. I mean, like tightness is quite common. So where the muscle loses its elasticity here. So in these cases, obviously, yes. I mean, first we would like to go ahead for the stretching program, so where the muscle gets the normal length first. So before gets the normal length, so there is no point in for example, like where the person doesn't have a normal joint range or the normal joint mobility. So in those cases, first we have to bring the stretching there where the joint mobility will come back. The first point is the flexibility. So once the flexibility is attained, then we can go ahead with the strengthening exercises that will build up the muscles where you will improve your muscle power. So when the flexibility and the strength both comes together, then you will make a successful path.
Thank you, Dr. Uma. Mr. Uma, just to add, like you were telling about the various pointers that we should remember, and what would be the preventive measures to take care. Earlier we missed that point from your end.
Yeah. I was just telling about the three components. I mean, pain management, strengthening, and balance and proprioception, where I've completed these three criteria. And the final one, what I was just telling about the lifestyle modification, which plays a major role there. So in lifestyle modifications, the fewer point which I would like to put forth is here, the joint protection techniques, where we can go for like orthotics. I mean, like any of braces or external devices which supports the knee, where the person or like an individual can walk normally. So in those cases, they won't be like functionally dependent. They will be more of independent there. So that is more important. The second one is like a footwear modification. This is one of the vital thing which we will be seeing there. For example, like as we get older, like I mean, not only as we get older. So on foot assessment, one of the major thing which we notice is like whether we do have a flat foot. So any of the persons with a kind of flat foot, so definitely where the lower bone, the shin bone gets more of rotated in like inward. So that causes adverse stress on the joint there. So that will put like, I mean, as the days goes on, like adverse effects on the knee, which will lead into osteoarthritis in the final stages. So foot assessment is one of the major thing which we will look for it. And being a physiotherapy, like we will try to correct the foot first initially. So for example, like a person with a flat foot, so we will try to get a medial arch support. I mean, like where there is an arch in the inner aspect of your foot. So that will raise the foot a little more up, and the stress on the knee joint will try to reduce it. And where the knee joint like stress reduces, in the sense, obviously there will be a lesser stress on the hip as well. So where the complete alignment has been corrected. So like in case of this osteoarthritis, like it's very, very important to examine the ankle as well and the hip. So these are the two main other joints which we have to examine when we do have any sort of knee osteoarthritis. If it is a hip, obviously we have to again evaluate, come back to the knee and the ankle. So always examining the three joints, or especially the... And the final one, yes, diet, which is very, very important here. So like they have to consult your dietitian, and they have to follow their according to their dietitian's advice as well. So especially people with obese, they have to follow the dietitian's order, where they should not put more weight, and they have to concentrate more on reducing the weight by putting forth whatever the exercises which we usually prescribe to them.
Thank you, Mr. Uma. You were mentioning about the flat foot. That's a very common thing here in India and in other countries as well. And with the obesity, it's more common, right? So, like you were suggesting, like analyzing the foot. So, is it like a common thing which happens in a orthopedic and a physiotherapy, or how is it like?
Yeah, it is very, very common. For example, like in a day, like at least minimum 2 or 3 patients like comes with a flat foot. I mean, which they like unknowingly, they doesn't know that they have a flat foot. When they come for a hip pain or a knee pain, which is completely unrelated to that. So when we make them to stand, then finally we came to know that, yes, there is a problem in the ankle joint. Once we correct your ankle joint, the knee and the hip problem just goes off. So it goes off in that way. Yeah.
Just to conclude with Dr. Kini about the same, Dr. Kini, is it like always seen that a person with a flat foot or such joint disorders will also have osteoarthritis, or like is it a different case? You're on mute, doctor.
Yeah, so as Uma said, a lot of them is actually interconnected. So hip, knee, ankle, they're all connected by an axis, which we call as mechanical axis. And they all have to be in a straight line. So people who have, flat feet actually have a deformity of the ankle, wherein the arch spaces are reduced and it's collapsed. They put more weight on the inner side of the knee, and they're more liable for arthritis. Similarly, with people who have knee arthritis on one side are going to load the ankle more, and they're going to have ankle arthritis, over a period of time. So it's important to say that not all patients with osteoarthritis of the knee have an ankle problem. But definitely you should look at a joint above and joint below. So always look at the hip and above and the ankle below and assess, because all of them have to be corrected simultaneously. Just correcting one part of it will not help, and will in fact load the other joint, in a more worse manner. So it's important that a thorough assessment of the patient as a whole is important from our side as well as the physio side.
Thank you so much, both Dr. Sunil and Mr. Umashankar for joining us today. And we hope a lot of our listeners listening to this session would have understood about what is osteoarthritis. And we hope that the awareness program can actually create they have got a lot of information about what is osteoarthritis, and when actually they can visit their orthopedic and go with a proper physiotherapy to get cured. As the disease is not a completely curable, but you can at least maintain and have a very good life. Thank you so much both. On behalf of the IHW Council, I want to thank both of you, Dr. Sunil and Mr. Uma, for joining us and creating awareness about the disease. And I would also like to thank Manipal Hospitals for collaborating with us for this session, and a very insightful session. Thank you so much again.
Thank you. Thank you so much.
Thank you.
Well,